And so since most women we work with complain of fatigue, this is always something we look for because it can indicate, not only like a frank anemia, but what's called iron poor blood. So you might have low ferritin, but normal hemoglobin A1C, which is, or not hemoglobin A1C, normal hemoglobin, and hematocrit, which is just your information about your red blood cells. Because if you don't have enough iron, if you're deficient enough, it can cause issues with your red blood cell formation. That's an actual anemia. But a lot of women don't have an anemia. They had a CBC done, like a complete blood count. Their red blood cells look normal, no further evaluation needed, right? But they have low energy. So the thing about low ferritin or iron poor blood is that it can cause symptoms of anemia, even though you're not bad enough off where you have an actual anemia. Does that make sense? Okay. It's kind of like a subclinical anemia, but it's technically not in the anemia category. So what is optimum ferritin? Anything above 70 is typically the cutoff that we like to see. So we want to have a minimum ferritin level of 70 and above. So one of the reasons why we can see low ferritin, even though we're no longer bleeding, some of us, is that as we get older, our digestive vitality decreases, and our ability to absorb iron in our diet and other macro minerals like calcium and magnesium, by the way, it's decreased. We can't absorb them as well as we used to. So we need that iron for red blood cell formation. And if you don't have healthy red blood cells, it can actually lead to brain fog and low energy and all of that. So, you can be anywhere on the spectrum there and have symptoms if your ferritin is below 70.